Welcome to Newsroom Africa at this time of crisis, with the public health system buckling under extreme strain and with rising concerns about the effective use of public funds to fight the coronavirus. We're now joined by Minister of Health, Dr. Zweli Mkhize. He'll be answering your burning questions tonight, as well as updating on government's efforts to stem the tide of COVID-19 infections before the expected peak. Minister, good evening. Thank you so much for talking to us this evening. Let's just begin with an update of how things are looking.
Well, good evening to you and to all the viewers. At this point, we have an increase of to 445,433. Those are the latest figures in terms of the new recorded positive cases. Overnight, I think on the 24 hours, we have had 11,245 cases, and then of course they are distributed across the different provinces, mainly KwaZulu-Natal, Gauteng, Western Cape, Eastern Cape. The other provinces are also increasing, but those are the main four that are taking the major strain.
And Minister, let's talk about, the very provinces themselves. How have you found, things to be, particularly in your provinces like Eastern Cape, Gauteng, as well as KwaZulu-Natal?
I think all the provinces have actually taken the strain. It is expected that COVID-19 will exacerbate whatever weaknesses might have been in the system before. So if there was weakness of management, if there was weakness in terms of poor infrastructure, weakness in the challenges of human resources, all of those are coming out much more strongly, and it is our responsibility to try and manage the situation to reduce the impact of all of those. We have, however, gone all the way to increase the numbers of beds in all the provinces in line with the expectation of the surge. We've also increased the human resources, and we are still going out to employ new people as they are needed. And then we have to also upgrade hospitals where there are challenges of dilapidation, infrastructure, and so on. I think the major issue for us is to ensure that there is still good quality care of the patients, especially because almost 12,000 nurses and doctors and health professionals have been infected over the period, and in the course of all of this, some of them have to be out on quarantine or isolation, and as a result of that, then it becomes necessary to increase the staffing. So we are finding that there are challenges in various hospitals, but we are managing.
And Minister, you visited the Eastern Cape. What are some of the areas of concern for you there when it comes to interventions?
Well, the first issue was to focus on the weak management of the health system, and in this case, we decided that we're going to put up a team, which we're calling the project management unit, that will speedily move and deal with issues that relate to the response to COVID-19. The second aspect is to also look at all the beds that are available, make sure that all the necessary equipment is well structured to service those beds, and also focus on the appointments of the management as well as the human resource components that were running short, and then deal with the question of good relationship with the unions so that there's good communication, and we make sure that they can resolve the issues without any need to go into protest, and that management is sensitive to the concerns of the staff. So we put all of these issues together, and we believe, therefore, that there's a lot of progress. We also had to deal with the issues of oxygen supply. There's the basic problem of oxygen is that the demand has increased in the whole country. We did anticipate that, but in particular in this area, the production of oxygen is on one side of the province, so moving the oxygen into the smaller hospital further up in the north has been a challenge. So we've actually had this team focusing on speedily setting up additional tanks and additional oxygen cylinders to cover the small hospitals in the districts.
And Minister, there have been concerns, I mean, around the system in the Eastern Cape, with some saying that it is, has effectively collapsed, and that, that province should be, that system and that department should be placed under administration. But you don't seem to agree here. Why?
Well, where we can agree is that the Eastern Cape is going through a serious strain. Secondly, we must agree that the province did have its own problems in the health services even before the hospitals were in real trouble, and the staff was migrating out of the area. And then we had reports of various challenges in the quality of care. So those instances have been there. But what we thought was the best way here was that we didn't have any problem of obstruction, which normally tends to bring us to a point of having to take over when the administration doesn't do what is expected to do and doesn't respond to any sort of encouragement and support. It's important for us to give in support first and prove that the support was all they needed so that they can do what is necessary. But if the support does not work, and if there's reluctance or resistance to any kind of support, then we would have to issue directions in terms of Section 101A to say you are going to do 1, 2, 3, 4, here's your timelines, and if you don't do so, we're going to then move on to Section 101B, which is where you take over the administration. So you cannot just walk in and take over. You have to actually prove that everything else failed, and therefore you take over if that becomes necessary.
And Minister, I know that we are now in a very difficult time. You have, even told Parliament recently that COVID-19 now has a name, it has a face, it has an address. It is no longer, hearsay. Everyone knows somebody who has been infected, and you were encouraging people to act responsibly. Around this time, we've entered the peak. What is your message to South Africans that are watching you tonight?
Well, my message to South Africans is that we can beat COVID-19, but that is up to us in the way we behave. We need to make sure that we take the issue of COVID-19 seriously and wear masks when we get out of our homes. Make sure that the social distancing, use hand sanitizers and washing of hands, use cough etiquette. All of these are very, very important issues because this is the way we're going to be able to survive living with the virus. Therefore, we are saying we can see the differences in some areas, which means if we were all supposed to change the behavior, we could actually reduce the numbers of people who are infected. But because some of us are not doing it yet, it becomes a problem. There are still people who will go to funerals with too many people, much more than the 50 that was prescribed. There are people who still go to parties. There are people who don't still wear masks. This is what we need to correct, because everything else now about prevention of the spread of the infection does not depend on the hospital or hospital staff. It depends on human behavior, how each person behaves, and how to make sure that we can limit the chances of each of us getting the infection, cleaning up and sanitizing all the surfaces which are being frequently used, and make sure that everybody is working with an understanding that anyone else could in fact be COVID positive.
Well, we did promise that this will be an interactive session where you get to ask the Minister some of those burning questions that you would have had and not being able to get some of those answers there. Let's start with Twitter. Ben Chef asking, what is the implication of corruption on the spreading of the virus? I'm not sure if you heard that question, Minister. What is the implication of corruption on the spreading of the virus?
Well, corruption is a problem. Whether there's COVID-19 or not, corruption is something we must fight. It wastes resources. It takes away resources that should have been used, to develop communities and provide the services. It is a cancer that we must fight against, and therefore the impact of corruption would be that it actually diverts resources that we would have needed to make sure that our people are developed, that we get all the services that we need, that we can improve our health services, that we can employ more nurses, more doctors, and give more medication. So all of this means that we must just fight corruption. It is a function that each and every one of us must perform, and it's something which all of us as South Africans must take a stand to say we will fight corruption. And corruption was there before COVID, it's there during COVID, it will be there after COVID, we need to make sure that we fight corruption at all costs, and that for me is the message, and it actually can worsen our situation only so much as it will remove the resources we would have needed to mount a strong and effective response to COVID-19.
And I understand on the line we've got Tabang, who would like to ask you, Minister, just how things got to this point. Tabang, good evening.
Good evening.
What's your question for the Minister tonight?
Okay, thank you very much. South Africa's COVID infections have risen to a record high in the past few weeks, joining countries such as the USA and 3 BRICS members, which is Brazil, Russia, and India, into the top 5. So my question really is, how did this happen? Especially given the fact that, not long ago, South Africa was congratulated by WHO for strategically locking down the country, therefore taking quicker steps to manage this. Is it because of civil or community disobedience? I'm saying civil disobedience, but not taking away the fact that, our country is riddled with poverty, and it is practically difficult for many social distances when we live in poor living conditions and in informal housing. So, really, Minister, how did we get to a point where we are now in the top 5 in the world?
Thank you. Tabang, Minister, you want to take that?
Yes, please. Thank you very much. And I think it's a very fair question to ask. All of us didn't expect that would be as high as this in terms of our positive numbers, but here we are. If you look back at where we started, we tried to control the spread of the infection, but we could only do so using a lockdown, which means people stopped moving, but that was not enough to get the virus out of everybody's system, because whilst people had stopped moving due to the lockdown, there were still a spread which was called the community or internal transmission, which means where people met, they were still spreading the infection until there was a broad enough base to allow the infection to grow as fast as it has done right now. So we actually asked that people must start using masks, and then we stopped some of the large gatherings, and we encourage everyone to use sanitizers and so on. Now, the extent to which people are not able to do so is what actually creates an escape route for the virus to spread even more. So the number can grow as high as anything, as long as we in South Africa are not all using masks and so ensuring distancing, ensuring that we sanitize the surfaces. We actually had an interesting discussion with the various world experts on this matter. And we asked them whether, in fact, they believe that we should have extended the lockdown or should have closed the lockdown further. Now, they also confirmed, like our advisors and modelers were saying, that, a hard lockdown has got a lot of detrimental impact over the community, particularly on issues that relate to, income insecurity, hunger, and lack of, poor economy and so on. So, for people to be able to sustain themselves, we needed to get back to a normal activity and economic activity. But our inability to social distance, when you still have people going out and doing, weddings with a large number of people and parties and so on, those are the opportunities for the infection to spread. So the numbers will always grow. It depends not so much on the nurses and doctors, but it depends on how well as community we can break the cycle by increasing distancing. We're still using contact tracing. In some of the instances, people refuse to participate, and in some instances, it took a long time to be able to get to know whether the person was positive or not. We've corrected some of that, but at the end of the day, it had more to do with the fact that the spread never stopped, continued.
Minister, I'm going to allow you some time just to, catch your breath and be able to get a glass of water there. Remember, viewers, this is your show. This is your hour. You get to ask the Minister all the questions that you, continue to be burning for you. And we will continue with the Minister after this.